Hello, dear gentlemen, dear ladies, dear colleagues. It's my great pleasure and privilege to present to you an innovative program for a web-based platform on the ground of risk assessment and management strategy. I am welcoming you to this conference, and we are excited because we are convinced that web-based solutions are critical for the future of substance use care, of implementing online prevention strategies, of providing psychotherapy to everybody who needs it. And the risk assessment and management idea is pretty much a framework which we are using, and I would like to share with you our ideas, our concept, and what you have to expect. I'm starting with a famous European researcher, Albert Einstein, who mocked his colleague with the sentence, "Insanity is doing the same thing over and over again and expecting different results." I thought that is a fantastic sentence for a psychiatrist to start from. And what is the reason we need to disrupt substance use care? Why do we need to reconsider what we are doing and can't be happy and satisfied? First, the accessibility and the capacity of basic healthcare is unacceptable. To give you one example, in the current overdose crisis, only 20% of the adolescents in North America who survive an overdose get access to appropriate care and help to recover from their problems. And anyhow, in 80% of the countries, we don't have mental health care or substance use care. And in general, also in North America, the majority of psychotherapies need to be paid out of pocket and are only available for a small minority of us. So, and that's in strong contrast to the fact that 80% of the funding related to addiction is not spent on treatment, but spent on enforcement and jurisdiction and administration and other things, which is a sad story and a very unsuccessful one. So I want to start with a very bold statement and my objective for my engagement with web-based solution. Our communication is changing. It's changing in education and it's changing in healthcare. And the reason for that is that this is the only way for bold effects in a lot of areas. So comparing the different steps and levels of innovation, only if we are changing our game, we are able to succeed and change what I stated in the beginning. So it is a lot about disruption, and keep that in mind, please. The concept of risk assessment and management is based on a few basic thoughts. It is an accepted and not labeling concept. It's trying to describe, based on evidence, what risk means and what the different risk factors mean for the individual. It's beyond just psychopathology and allows an interdisciplinary approach. It has significance for the whole trajectory, not only for acute care, from lifestyle mentoring to targeted prevention and to psychosocial and medical or physical treatment. And it's especially helpful and well suiting for the overdose crisis we are trying to address as best as we can. There are 4 elements in our idea and in our concept, which are important not in a stepwise way, but in an ongoing way. because informed decision-making and understanding risk and developments is important in the very beginning, but it's also important after relapse. It's important on your way to recovery, as well as is assessment and goal setting. We try to help with our assessment tools, our users, as well as professionals, to get the best possible and appropriate understanding of the situation. And for the users to define their individual goals based on that and follow up in terms of monitoring your goals as a guideline on this journey. The risk prevention and management component means to provide different interventional tools, from positive psychology to crisis response, and from navigation of healthcare system to cognitive behavioral therapy. I will explain that in more detail in a minute. And this leads and allows to stabilize and to recover from all the experiences which actually leading very often to high-risk substance use in the first place. So what are the core challenges for an online system? Challenge number one is engagement. As we know, there are thousands of online apps out there for any area, any domain, and only a small minority is making it, is becoming attractive and is engaging with users. So we have to give the engagement a very specific thought, and we will discuss and develop a specific engagement strategy for our target population. But we see this as one of the critical challenges in developing a system. Learning means that system needs to change. It needs to absorb the information and the experiences through users, but also feedback from professionals in different ways in order to become better, more appropriate, and more helpful. And that's something we're doing in close interaction and collaboration with users, peers, families, professionals, everybody who is benefiting from RAMP, to inform and be part of the development team. And last not least, we need to build and align it with the current system of care. So implementing in the right way is a very important step. The screenshot on the right shows you a little bit how a dashboard will look like and what the recommendation may look like for the users based on their goals and based on their ideas and questions. What are the advantages of a platform like this? The integration into the current system of care is supported and will be easy. It could be used as a self-help tool, but also as a tool with limited support or integrated into a therapeutic strategy. And it will document and assess in order to make better referrals and to learn from user experiences. So that way, we also want to empower users to do better and to more successfully interact with their challenges. And that way, it will be also an open system. We want to use that as a starting block and add other risk components to it, which I will explain in more detail. So what are the high-risk domains in substance use? They are, interestingly, far more than just overdose and lose of control and so. And as you see in this nice little picture, there are lots of things which are coming from the traumatic experience, from social inequality, from violence, experience violence, and all kinds of mental health challenges. And based on that, everybody, so we identify a hierarchy of risk for drug users, starting from the top right, where you see the number of fatalities in British Columbia based on overdose, which is much higher than the fatalities due to COVID-19. So surviving an overdose is a critical goal for any drug user, but also preventing overdose situations, being able to control substance use, to avoid adversities, cope with mental challenges like trauma, and entering access appropriate resources, which is not only the problem for users, it's also the problem for the system and how it responds to the specific needs of highly vulnerable populations. A key thought behind all of that is we want the user to become in charge of his life and his situation, because as professionals, we're only spending a small amount of time with them. And we want them to be effective in their risk management. And we want them to use the toolbox we are offering and empowering them to reduce their risk and recover. Support informed decision making, so that they knowing what may happen and able to respond to that. This is graffiti in the downtown east side of one of the most beautiful cities in the world, and for sure in North America. And it is mourning the death of a friend. And right now we are in a situation in Vancouver where 1/3 of the population knows somebody who overdosed or died of an overdose. So it is not a rare exception and a problem for a small minority of individuals. So what are the functionalities of RAMP and how do we want to support them? So we separated out the functionalities in 6 different levels. The first one is also in the personal journey, engagement. And engagement from a user perspective could start with your primary care physician in your substitution program based on peers or your own research, your family. And if you start using RAMP, you would then try to understand what your options are, what potential goals are, and to then choose, and based on referrals, to choose the components and the modules we are offering in the system, which I will explain in a second. So why is engagement so critical? Engagement for every online system, as well as for treatment in person, is so important because it is the key to success. Only if users are attracted and convinced that's a good thing to do in any kind of treatment setting, it will be successful. And for the overdose situation, that is specifically important. For that, we're using strategies like gamification. We will integrate it into the system of care in order for our professionals to support the use of RAMP and make engagement an ongoing strategy based on a good presentation of RAMP, but also on an easy navigation and attractive environment. We are offering that. On the other end, we have a system of data collection which should help to make the system better, more effective, and interesting. So in order, for instance, to assess outcomes and in order to predict the quality referrals we have in mind for them, you need to collect these data and anonymously and make then the best possible recommendations to them. The interventions are separated into very specific one, into more general tools, into generic parts and knowledge translation, and in assessment. The very specific tools here are addressing the overdose situation. For instance, the training with naloxone, the safe consumption and measures of support through peers, and the introduction to substitution treatment. The more general tools are addressing also the mental challenges which coming to it. There is probably not one patient in the system who is only coming with a slight increase of recreational drug use. The patients, the most vulnerable, are coming with severe traumatic experience, with depression, anxiety issues, and all kinds of other challenges, which are very often the reason for them to take high risk in using substances on the street. And we want to provide a set of tools from positive psychology to a symptom diary and generic supports like CBT for depression and pain management. We're doing all that. These are only examples. We're trying to develop a set of tools which is getting more specific and better along the way. To navigate the healthcare system, is important to find the right and appropriate supports, to know what specific risks mean, like the risk, you need to explain and understand how an overdose is functioning and what is contributing to a very high risk situation, and to provide ongoing structures and supports in the most basic daily challenges. And last not least, the assessment domain is providing a system from screening, like here with WHO Assist, to gold standard assessments, combined with a tool helping you to set your own goals and really successfully follow your own path by monitoring outcomes and your coping efforts. Here you see another screenshot from our current version of what we're doing. So how to access the different modules, how to work with your goals, how to reflect your situation in a symptom diary, and assess the current risk situation as best as possible in order to be really aware of what may happen and what to avoid. And a few other tools. And the system will be available in an early version, beta version, in spring next year. Okay, I mentioned in the beginning, in order to help high-risk drug users, it's very important also to address underlying mental health issues, to provide counseling and mental health care, to help them with their physical health problems. And these resources are very rare. So we want to help building them on an individual and on a system level. And that's what the next stage and the next step we are starting to envision and plan for RAM are working on. So the elevator pitch for that is we want to go from an overdose crisis response to an online resource for mental health, because substance use is not coming on its own. We want a clear user focus. with open access for social networkers and other parts of the healthcare system or the social support system if the users think that is important and useful. I think the housing staff and housing workers are also an important example to look at. And we want to use the information we are gathering to create a learning platform, which is getting better with every user. So the vision for that is addressing, especially and starting to address other conditions which are of high risk and which are especially common and important for the healthcare system and badly managed. So 600 people in British Columbia per year are dying from a suicide attempt. And 10% of our students are suffering from suicidal ideation. So we need to find a better way to deal with that. So self-harm is a component of that clinical trajectory we want to put into the focus of our efforts if we are on a good, safe ground with the overdose trajectory. Another one is the very rampant trauma experience. 2/3 of the vulnerable urbans gone through early childhood trauma experience, and we're not offering really systematic trauma treatment at all, which is very often a key reason for people to use substances, and especially young users, which we want to address better and with specific engagement tools, are the most neglected um, population in the system. I mentioned in the very beginning that only 20% of adolescent users experiencing an overdose have access to quality care afterwards. So yeah, I mentioned that here. I give you one example. Our current assessment of suicide risk and risk of suicide attempts especially is not very successful. It will become more successful with also the use of innovative technology and building on the different domains of neuropsychological assessments. So there are promising approaches, and I think in a few years we will have as a routine online assessment, which take no more than a few minutes and allow you to predict suicide attempts in a very effective way. Self-harm is happening very often and is very often for users a way to reduce the tension they're living under. But there are better ways to deal with inattentions. And dialectic behavior treatment provides a few key tools to do that. And we want to make those tools available in a digital format as part of our platform. So I already mentioned the trauma trajectory, but it's very close to our heart. So we want to understand and we want to help, especially with this rampant experience. Next step should address the tertiary care area because that is the most vulnerable population which failed in the current treatment system. And we want to complement existing efforts, for instance, in British Columbia, to provide good community-based tertiary care, but also support efforts in our current system, like the Burnaby Center here in British Columbia. So I already mentioned the use trajectory, and to save some time, move on. The functionalities we want to build on are also mentioned, just to give you an idea. I can't describe it in detail, so feel free to join us in our workshop. Is the diary is a visual component which is bringing together the keys outcomes to monitor and the efforts to improve coping and the goal and goal attainment system in order to, like a little bit like a mental fitness tracker, to make sure that the users are motivated to continue working on that and stay connected with their support and their resources. And last not least, it's also important to link them to all kinds of resources, like to the physical system of care, to crisis management, and to essential information and documents, which needed to be shared with, for instance, with acute care in case of an overdose, a crisis, or a suicide attempt. By the way, I'm including a lot of pictures here in my presentation, and all of these, or most of them, are done by people with lived experience. And for me, it's really capturing in a fantastic and important, impressive way what they're going through. Art with a meaning is a way also for us to better understand what we need to understand in order to be successful professionals and successfully supporters. So what can users expect from that development? Better access to resources, more choice and empowerment for them, quality care through better access to expertise, and all kinds of online programs which are proven to be effective, and tools for self-help and self-assessment they can use totally independently. And what can professionals expect? An additional resource which helps to build capacity in an under-resourced system, supporting mental health care and substance use care, and integrated with a documentation system which helps to improve the communication between the supportive network, with a growing range of assessment, monitoring options, and supporting outcome-driven approaches. That said, back to the disruption question. And I try to summarize what I want to provide as take-home message. In order to organize disruption, we have to build on three components, which will be more and more important for the organization of healthcare. One is the traditional physical healthcare, another one are web-based resources, and the third one are virtual clinics. Web-based resources available to be used independently, virtual clinics for the communication between experts and therapists and users, and physical healthcare traditionally to deal with problems in a face-to-face contact. Okay, that structure, basic structure, would be a disruption to the current system of care, which is totally built on face-to-face context. And only in the COVID pandemic learned more about the benefits of online resources and video conferencing. Okay, that means, in summary, that RAMP would be a big step forward for a web-based platform and a framework for the whole system of care. A virtual substitution clinic focusing on drug users, which is providing the interaction with professionals, the prescription of drugs, and the ongoing care for users all over the province, and ideally then over the country and internationally. We want to make it as accessible as possible. And last not least, to organize in-person care, mainly where people live and also outside of institution. So I called it home care, could be called assertive community treatment, but we want to pick people up where they are and not waiting until they are lying on a stretcher in an emergency room. We think that this provides us with the opportunity to really make a difference compared to the current situation. Not more of the same, not just maintenance, working as a self-help tool and independently, as well as a system asset building capacity, giving our users more control and based on that, more confidence, and adapting stepwise and more to the needs, learning from them, and providing more evidence to guide our systems. Starting with Einstein, ending with Einstein, we cannot solve our problems with the same thinking we used when we created them. We need to start to think different. And we are only able to build the capacity needed, which is huge, if we use modern communication tools and integrate our system of care into a web-based framework. The next step will be very interesting, and it's not the last one. We're opening a new stage in spring 21, and we are very curious what you think about it, and I'm inviting you to our breakout session to explain a little bit more about the functionalities. Thank you very much.